Imagine a bustling hospital hallway in Cleveland, where Dr. Susan Mayers just got an urgent page. She's frustrated not with medicine, but with how little communication she's getting from her hospital leadership. What if this disconnect could be fixed? What if physicians, your most valuable allies, actually felt heard and truly aligned with their organization's goals? That's the exact dilemma Kriss Barlow tackles, cracking the code on what physicians want and how to speak their language. Let's start with a question: what does Dr. Mayers want from hospital leaders? Spoiler, it's way beyond policy memos. In a survey of nearly 200 physicians, including Dr. Mayers, the loudest complaint was how leadership talked at them but rarely supported daily challenges. At Boston Medical Center, one physician recalls leadership promising new imaging tech, then never following through, eroding trust fast. Think of communication like a bridge, not a broadcast tower. Instead of throwing clinical data over the wall, leaders must switch to translators, relaying info so it's immediately relevant and actionable. It's like shifting from a foreign film with subtitles to a gripping native story. When hospitals invite physicians into real business talks, around cost, staffing, or technology, it flips the script. Instead of feeling sidelined, docs like Dr. Mayers become partners, driving innovation and accountability. Suddenly, healthcare isn't just about medicine, it's a team sport. Next up, how does a hospital really win the fierce game of recruiting and referrals? Hint, it's not just fancy tech or slick ads. At Providence Health, leaders revamped how they talked costs, showing docs exactly how choices impact the bottom line and patient outcomes. Dr. Allen, a specialist, felt empowered to discuss procedures' value, not just price tags, reshaping referrals organically. Patient satisfaction was often dismissed as fluff, yet physicians reported it's their secret weapon. Like Chef Ramsay tasting his own dishes, doctors monitor satisfaction scores as real feedback, driving improvements that matter on the ground. When recruiting new physicians, the key isn't just salary but alignment with values. Mercy Hospital's success came after shifting hiring talks from benefits lists to shared visions of patient care culture, turning prospects into lifelong team members. Finally, how do doctors and hospitals survive and thrive together in today's wild healthcare landscape of ACOs and shared savings? When a Chicago hospital rolled out their new accountable care organization, the docs hated jargon and empty slogans. But clear, pragmatic meetings explaining real patient impact outcomes changed everything. Dr. Patel recalls feeling in the loop for the first time in years. Shared savings can seem like a tease if it's vague. Mercy Health's transparent sharing of bonus structures and quality benchmarks turned incentives into motivators. Doctors shifted from skeptics to champions of cost-effective care. Measuring physician performance is a double-edged sword. At University Medical Center, leaders framed metrics as tools to empower, not punish doctors. This transparent approach turned competition into collaboration, boosting morale and care quality simultaneously. Back in that Cleveland hallway, Dr. Mayers feels a shift, because leadership finally spoke her language, showing real support and partnership. The secret: treat physicians like partners, not just providers of service. Try this next time you talk to a doctor: skip the jargon, ask what they truly need, and invite them into the conversation. It's not just medicine, it's about building a lifelong alliance. Subscribe for more book summaries like this one.